Hey, Dr. Brandy Archie here from OT Connected by AskSAMIE, where we are helping occupational therapy professionals think bigger, build smarter, and lead the future of care. And today we're talking about something every OT has felt, but very few have said out loud. We have an innovation gap. We are amazing at insight, at solving hard problems, but the profession hasn't kept pace with creating scalable solutions that change our systems and improve access and make care better at scale. But by the end of this video, you are going to understand why that gap exists, what barriers hold us back, and how OTpreneurs like you are already starting to close it. Okay, so here's why we call it an innovation gap. The term means a disconnect between knowledge and scale. So we have deep expertise in knowledge, but not enough of that knowledge actually turns into tools, technology systems, or scalable services that improve care beyond our individual sessions or clinics. OTs are trained to understand complex human needs, how people interact with environments, routines, and technology and roles, and that is a rare skill. Yet when we look at healthcare innovation, OT is usually not at the center of tech development, policy design, or scalable solutions. Meanwhile, professions that we work with but don't have our same scope are increasingly brought into the clinical technology design and app ecosystems and robotics and big data informed care. So let's break down 3 key reasons why this gap exists. Number 1 is workforce research is scarce and underfunded. A global review found that occupational therapy workforce research is scant, slow growing, underfunded, few studies using strong methods or exploring our international breadth. This lack of research investment means we don't have strong data to inform policy. We have limited evidence on our capacity and innovation needs. And we aren't generating the kind of evidence that changes systems. Number 2, educational preparation rarely includes innovation or technology fluency. So many OTPs report insufficient training in digital or technological interventions and implementation, even though our daily lives are becoming digital first. This is a huge mismatch when care increasingly interfaces with telehealth and wearables and remote monitoring. If we're not comfortable with those things, it's really hard to train our patients on it. Number 3 is traditional OT practice models are focused on individual care. And the profession historically thrives on that one-to-one therapeutic engagement, which is totally powerful, but doesn't naturally turn our lens to scalable product, service, or system that benefit at the population level, despite us having so much to offer in population health. Despite the gap, change is happening. Telehealth and remote services are making OT accessible beyond brick and mortar clinics. OT Kristen Knuckles and her company Imago Rehab have mastered that model and tailored it for stroke and cardiac rehab. Wearable tech and smart monitoring enable personalized data collection and interventions that extend beyond therapy sessions, which is great. Virtual and augmented reality for rehab can deliver high rep practice, which we know we need, and enhance engagement. And we've seen this with innovations in tools like NeuroFit and LudoFit, who are both designed and developed with deep insights from OTs. Adaptive robotics and assistive technologies are transforming daily living support. There are tons of OT inventors creating new products that are meeting specific needs. And these are examples of innovation applied, not just incremental improvements, but new ways of delivering impact. So why am I so bullish about OTpreneurship? Entrepreneurs are the bridge between insight and scale in every industry. You take the deep human understanding you have as a clinician and apply it not just to one client, but to systems, products, services, and models that can reach many. So think about it. A scalable digital assessment tool, a telehealth program that reaches rural populations, a wearable integrated home program for aging in place. All of those are things that do one to many. These aren't hypothetical. They work on an individual level, and entrepreneurs are finding ways to turn them into sustainable business models, which means they inherently impact more people. OTs have the domain knowledge and problem-solving mindset that we need for innovation, but historically we've lacked the resources and training and ecosystem support to turn ideas into scalable solutions. So that's exactly why OTpreneurship and communities like OT Connected actually matter a ton. So if you're thinking about building something that closes the innovation gap, here are some low-hanging fruit to consider. Getting involved in user-centered design. Include clients and clinicians in co-creation. Collaboration with tech developers. Help those products fit real needs. Evidence generation. Collect that data to show value and improve adoption. Scalable service models that provide a one-to-many approach. Policy engagement is huge. Shape the systems that allow innovation to thrive. This is where impact and sustainability meet. The innovation gap in occupational therapy isn't because OTs lack insight or creativity. We have tons of that. It's because not enough pathways have been built to turn that insight into bigger solutions. But we're going to change that. OT entrepreneurs are the ones closing the gap, turning deep clinical wisdom into products and platforms and practices and systems that improve lives at scale. And if you're an OT thinking about business, this is your moment to lead innovation, shape systems, and expand the reach of our profession. Thanks for taking some time. If you want more insights like this, please subscribe and join the conversation inside OT Connected.